Hello, guys. Welcome to another episode of The Value Your Health It's Gold. Remember, we are on a journey to assessing here the cure for your HIV and AIDS. My name is Maria Moses, and I am very passionate about the health and wellness of people, especially people living with HIV and AIDS. I am a public health practitioner, and of course I work to support change so that people can have certain knowledge to make informed choices or decision, and of course take control of their sexual health and general healthy lifestyle. And of course this is in a way to increase confidence and skill within people in order to obtain longevity of lifestyle or life among people worldwide. And then this is in support of the global effort to end AIDS and also achieve a sustainable developmental goal worldwide. Okay, so if you're looking for testing, you want to assess testing and treatment or linkage. Okay, so you are right there in the right channel. And then 1 in 7 people who have this HIV infection, really they don't know their status. So if really you're thinking about getting tested, you want to know your testing, please don't hesitate. You are in the right channel. Okay, and also if you want to have certain counselings, you want to know more about other sexually transmitted infections, or maybe you'd want to know some certain counseling or advice on sex and relationship, then you are right here in this channel. You will find lots more advices. Okay, so kindly subscribe to my YouTube channel, click on the notification bell for further updates. So very quickly today we're going to be talking about very important topic, and that's why I'm so excited to have you back here on this channel. Today we are going to be talking about the types of HIV testing. Before that, in my previous video I actually talked about certain samples, of course, that is being taken from your body and taken to the laboratory for this HIV testing procedures that I'm going to be talking about. I talked about samples from the blood sample, I talked about the dry blood spot, I talked about the plasma, and I talked about the sample from your mouth using the oral pick kit. Okay, so today I want to talk about the type of test that is being run, or that is usually run or done on those samples that has been taken from your body in order to give you or confirm if you're positive or not for HIV. Okay, so there are a lot of samples. We have different types of sample available. Okay, we have the nucleic acid test, we have the antigen antibody test, we have the antibody test itself. But before then, what is HIV testing? I know I talked about this earlier in my previous video, but I'll also talk about it here again. Now, the only way to know for sure whether you are positive for HIV or not is to go get tested. Right now, what is this HIV testing? The HIV testing is a screening test that is usually carried out in a healthcare based facility, or even in the testing centers or point, to know whether you're positive or you're negative for HIV. Now, the CDC, which is the Center for Disease Control and Prevention, actually recommends that everyone between the age of 13 and 64 go get tested at least once in a year. Okay, and you should make this a routine. Right, what I mean is this: you should at least make it an habit of going to know your status regularly, because you know what, knowing your status gives you powerful information, to help you to take steps to keep you and your partners, your children, your loved ones, healthy. Okay, like I said, basically about 1 in 8 people in the United States who have HIV do not know their status yet. So please go and get tested. And also, I want to say that if you are among the categories of people who I'm going to be listing now, what I mean is this: if your answer is yes to any question I'm going to be asking now, okay, to these questions, please, then you need to go and get tested. Okay, you are at risk. So are you a man who has had sex with another man? It is critical. Go and get tested. Have you had sex or anal sex before, or vaginal sex before, or probably oral sex too? You need to go and get tested. And then, have you had more than one sexual partner or sex partner? Then it is very important for you to go get tested so as to know your status. Also, have you inject yourself with drugs, or if you're the type who usually inject yourself with drugs or medications using certain instruments or devices that other people have used, then it is important for you to go get tested. And then or probably you share needles or razor blades or certain sharp objects. Please, it is very important for you to go and know your status. Okay, then are you the one who exchange sex for money? What I mean is this: you are a sex worker, and then you don't even know the status of the person you're having intercourse with. Please go and get tested. And then, have you ever been diagnosed of hepatitis or tuberculosis? It is very important for you to go and get tested. And then, if you have been diagnosed with certain sexually transmitted diseases, then it is important for you to go and get tested. And also, if you've had sex with people with aforementioned cases that I said earlier, it is also very important for you to go and get tested. Okay, so of course, sexually active gays or bisexual people will actually benefit from this program, in the sense that they are free to get tested at least 3 times every 3 months to 6 months. Okay, and these tests are free. All right, so the tests are free, although in certain countries and in certain private hospitals, what I mean is this: in some countries or some private hospitals, certain token or amount of money might be requested from you. Okay, this is fine, because this money will be needed or to purchase the kits that will be used for your treatment. Okay, and then of course to keep the facility or the hospital or the healthcare center running, because of course they will need money to get 1 or 2 things to keep the facility running. Is that clear? All right, so let's quickly proceed. Many people have HIV for years before they know it. So don't be the type who will be like, oh, I don't think I have HIV, I don't think I would have it. No, going to know your status is very, very important. So like I said, today we are going to be talking about basic type of testing that is usually done on the samples that was taken from your body from the laboratory. Now, I said we have 3 types of tests. Now, we have the nucleic acid test, and then we have the antigen antibody test, and then the antibody test itself. What does this nucleic acid test mean? That is the NAT. Actually, this nucleic acid test, okay, looks for the actual virus in the blood, and of course it involves drawing blood from your vein using the syringe and needle, which is a sterilized syringe and needle, or a new syringe and needle. Now, the test can either tell if a person, has HIV, or even tell how much, how much virus is actually present in the person's blood. And this virus is termed the viral load. Now, viral load actually detects the quantity of the virus that is in the person's blood. Okay. Then we have the antigen antibody test. Now, this antigen antibody test actually looks out for both the HIV antibodies and antigens. Okay, so these antibodies are actually produced by your immune system when you are exposed to the virus, and the virus like HIV. Is that clear? Now, antigens are foreign substances, that cause your immune system to activate. Is that clear? If you have HIV, an antigen called P24 is produced even before antibodies develop. So antibody tests are recommended actually for testing done in labs, and they are now common in the United States actually. Okay, so of course it's the same procedure, taking blood from your vein and then proceeding for testing. So the next test I'll be talking about is the antibody test. So, and this antibody test only looks out for antibodies that react to HIV in your blood or oral fluid. Okay, so, and then this can also be taken using the finger pricker or the syringe and needle. So that's that about that. Okay, so the next thing I want to talk about, okay, of course, these are common samples that will be taken from your body, using the finger pricker. You have the oral pick, which is often used for the mouth, sample collection, and then you have the syringe and needle that is used in drawing blood from your vein. All right. Of course, the time taken to get HIV results after testing depends on when you go for testing. Now, the no HIV test can actually detect the time immediately after you got infection. What I mean is this: if you get infected today, no HIV test can detect whether you have gotten the test today. It's not possible. All right, so it takes certain period of time. Okay. And then, of course, I talked about this earlier. The time taken from when you get infected to the time whereby you are diagnosed for HIV, or you are diagnosed for HIV, or you get to know your status, is actually called the window period. Okay, because I talked about the stages of HIV infection. If you listen to my previous video, you would understand better what I mean by that. So that video, my previous video expatiate more on what we call the window period. Now we have what we call the 4th generation HIV testing, which I'm going to explain very quickly. So what do we understand by this 4th generation HIV testing? It is very simple. I'm going to talk about what it means and also how it actually works. Alright, so now this 4th generation test or HIV test can detect both the HIV antibodies and the P24 antigen. Okay, but the older version only checks the antibodies. If you remember, I discussed that in my previous video where I talked about, for example, the oral pick. If you use the oral pick and you get a positive result, that doesn't mean that you are positive for HIV, and that doesn't mean that you are negative. Okay, so going further to the hospital for confirmatory test will tell you whether or not you are positive or for HIV or not. Okay, so of course, many clinics and healthcare providers will offer HIV testing for free. So, and the process is a straightforward process, and it's usually just taking small blood sample from your finger or from your vein just to carry out the test. All right. So how does this fourth generation HIV test works? How does it really works? Is it magical? No, it's not magical. It is very, very simple. Now, the fourth generation test actually detects two factors in the blood, which is the HIV antibodies and the P24 antigen that I said. Now, when a person contacts HIV, the immune system, start to produce what we call the HIV antibodies. Now, this is the body's method of fighting the HIV virus that came in to the body as a stranger. Now, the immune system produces these antibodies in response to those P24 antigens. Normally, once the HIV virus comes into the body, it produces an antigen. So these antibodies that are being produced by your white blood cells is in an attempt to fight these antigens that comes into your body. Okay, so the P24 antigens are a part of the virus, and of course, research has indicated that they tend to, appear within 2 weeks of HIV infection. That is, the moment you are infected, within 2 weeks it begins to show some symptoms. Okay, so now this fourth generation test is actually reliable, and it can detect HIV as soon as 1 month from the period of infection. Okay, and it is reliable. All right, so let's look at HIV test results with the serial rapid HIV testing algorithm. We have this test is actually done using 3 simple test kits. Okay, and this include the determine test, the Unigo, and STAR-Pack, for HIV diagnosis. So I'll talk about them so quickly. What we understand by this rapid test, because rapid test, of course, is provide same day result, and of course they are widely used in HIV programs, of course, in areas with limited personnel and laboratory infrastructures. Okay, so of course the CDC recommends this serial rapid test. Okay, of course it's an algorithm that makes use of the determine, which is the test kit, the Unigold, and then the STAR-Pack, okay, to determine whether a person is positive or not for HIV. Now, the test is a straightforward test, okay, which gives you the results just immediately. All right, so immediately, just for you to be able to continue with your treatment. So now this rapid HIV test provides quick result, and is usually within 30 minutes or in less than 30 minutes. Okay, and it is must be conducted by a trained health worker. So it doesn't really require any sophisticated equipment at all, and the equipment are also stored in a very appropriate environment. So, and of course it's similar to that of the fourth generation, because of course the fourth generation test also use what we call the ELISA, which is the enzyme linked immunosolvent assay. It's also a part of the testing procedures. So these are the pictures of the test kit that is being used to determine, that is basically mostly used for the rapid HIV testing algorithm, okay, to know whether you're positive or not. Alright, so getting tested again means that you have gone to the hospital, you've gone to the laboratories, and your test result happens to be negative. That doesn't mean that you are negative, truly negative. What it means that go take a break, after 3 months come back. So if you've gone to the hospital and you've been tested positive for HIV, negative for HIV, remember you can only be sure if you are HIV negative when you have done what? You have done a test after your window period, and then is bringing out a negative result, which means when you go for testing and it is negative, does not mean that it's negative. Go back after 3 months to check again to ensure that truly you are negative. So the bottom line is this: the fourth generation tests are accurate tests and can detect HIV sooner. Okay, so they are not that difficult. They are not difficult. And then if you've been exposed to HIV or you are at higher risk, routine is very important for you. Routine test is very important for you. I mentioned the people or the categories of people who needs to undergo routine HIV testing. Okay, so and then what getting to know your status on time means that you're going to assess your care and treatment immediately. And once you assess your care and treatment immediately, it means you're going to be having a longevity of life. You're going to enjoy your life. You're going to see that you take care of your family. You're going to see that you become who you actually want to become in terms of career, in terms of career and future endeavors. So having HIV does not mean that it is over for you. What it means is that you're just beginning your life and you are about to enjoy your life. So guys, I'll be wrapping up here. I'm going to be stopping here, and then thank you for watching. I really thank you for your patience to listen. Your patient here, and I would advise us, I'd advise us, or I'll advise us to, join hands to fight HIV and AIDS in our world. Okay, so by sharing this video to your loved ones, your friends, and your well-wishers, so that they will follow on this channel in order to learn and know how to avoid getting contacted, and if they are positive, they are going to be learning how to live a negative life. Just live as a negative life. That's why I said we are on a journey to detecting, to accessing the cure for HIV, and if they are negative too, how they have to live so as to prevent themselves from getting contacted. All right, so in my video in this channel, you can also visit me or chat me or email me through my email to know or to access certain project materials or certain information on HIV. So thank you guys for watching. I'll see you in my next video. If you like my video, kindly give me a thumbs up and then click on the notification bell for further updates. So thank you and do have a wonderful day. Bye.